What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, September 27th, 2023. That's right, we're coming near the end of September. We do have a few news stories to report to you today, and then we have some data that we're going to show you from a few different things. One of them being Hubbub World. We have not shown that in a while, and there's a few things I want to point out on that. And you may notice today we're not on camera. We've been having an issue with our camera today. Every time we go to start the update, the camera just randomly freezes. I don't know what this is about. I will try and rectify that and get ourselves back on camera for future updates. Alright, starting off today, a representative out of Missouri, Corey Bush, has tested positive for COVID and is working remotely. I'm not seeing if this is her second case or third case. We know some representatives and senators have had several cases at this point, but I'm not seeing that right now. But I will keep looking because I'm going to add this to the archives of my sites, as is this next thing I'm going to show you. And this comes from Canada. Seaforth Community Hospital is reporting that they are seeing a COVID outbreak. It says the inpatient unit in Seaforth is now closed to admissions until further notice. Those visiting patients at the hospital are required to follow any posted instructions and are asked to limit their interaction to one patient per visit. So yes, there are outbreaks still occurring, and to be fair and to be honest, we only just report on a handful. Most outbreaks that do occur with COVID, and this doesn't just go for Canada or the United States, this goes for around the world. The majority of them are not reported to the media. Prime example, I have seen signs, I know other people who have seen signs when out delivering to nursing homes. They'll have a sign on the door that says, hey, COVID outbreak, you must be masked to enter, or they will see the nurses or the staff masking. And guess what? That's not an outbreak you hear about on the news. So there are way more outbreaks than the number that we see me report. Just a small number that I report on doesn't even probably scratch the surface of how many are actually occurring out there right now at this time. Also, moving on to this will also make my website. Bruce Springsteen and the E Street Band postpone remainder of 2023 tour because he has to continue seeing treatment for his peptic ulcer disease, which he was dealing with earlier this month. And because of that, guess what? The remainder of his tour for this year is being canceled. Now let's take a look at air qualities. And air qualities overall are not too bad. You're seeing some yellow in the east, but to be honest with you, that is not all that bad. You're not seeing a high 100s in the east. You're seeing a couple areas above 100 in California, in Oregon as well. There's still some wildfire issues going on there. It's not as bad as it was. What we will have to watch is that whole cloudy weather air mass is going to be moving back into the mid-Atlantic and Northeast tomorrow through Saturday. And the last go around, there were some generally poor air qualities on that. I know it made me cough more, which sometimes happens when we get into these foggy, misty patterns. And there could also be a big flooding event that goes on in this area. See my other channel. I think I am going to do an update just specifically on that event because it is concerning. Speaking of weather and health, let's take a look at our heat-related illness map. You can see there are still some incidences of high call volume for heat-related illness in Florida, South Carolina, North Carolina, even in southeast Pennsylvania. This could continue because there are indications that there are going to be well above average temperatures in these regions next week. So we could see this continue, where we're seeing less calls for heat-related illnesses on the West Coast right now. And we hope that remains the case for the foreseeable future. Moving on now, taking a look at Walgreens. The national positivity rate this week is 27.7%. The prior week was 32.5%. That's a difference of down 4.7%. Total tests, 9,915. The prior week was 6,728. It's getting closer to 10,000, but ideally, we all know we want to see it a lot higher than this, like 20, 30,000 tests. even at that, that's a low number. You're talking of a country with well over 300 million people. We need to see these testing numbers go way up. But I get it. PCR testing is expensive. Taking a look at the wastewater from BioBot, which now updates on Mondays, so we may do a change to which day we do our wastewater updates. Stay tuned for that. And the majority of the United States is dropping on BioBot, with the slowest drop being in the Northeast states. And I will kind of show you why that's happening in just a little bit. Here's the CDC. We know there's a lot of orange and red still. And I wanted to show you this today. College Park, Georgia. Why am I showing you College Park, Georgia? Well, remember yesterday I showed you Los Angeles, California. There was an Mpox case yesterday. Well, it has been brought to my attention that there is another Mpox case out there. And this time it is in Georgia, that it was detected in wastewater. First off, COVID in wastewater is dropping at this wastewater site in Georgia. Influenza, not an issue yet. RSV, the overall trajectory trend is upward since about August. It peaked back in August 29th and it dropped, but now it's rising a bit again. HMPV, not an issue. Norovirus is dropping at this time, but then you see here, we go back to September 12th, there was a detected case of Mpox. Here it is right here, and you can see here that it was detected. It's red, so that means there was a pretty strong indication that there was a case in this area. How about hepatitis A? No issues with hepatitis A at this time. Now taking a look at the latest variants, and we do know EG.5 is at 24.5%, and HV.1 is now up to 8.4%. We should get another update on the variants this week, I believe. Now let's take a look at the hospital activity in the United States, and we can see here admissions in the past week, 19,674. All right, we do want to take a look at some of Hubbub World and their data. Let's refresh this to make sure it's the most up to date. And what I can tell you is there's some really concerning numbers at this time ongoing up in New Jersey and New York, and that's what I want to show to you today. Because when you take a look at New York, you're going to say, well, wait a second, I thought the numbers are starting to drop across the country. And for the most part, they are. But we do have a few individual states which are not doing that good. Taking a look at New York State here, this is for a COVID prevalence. You can see here, really high prevalence in and around New York City Metro. And when we take a look at flu, we can see flu, it's starting to show up in New York City. How about RSV? There's a little bit of RSV showing up. But then when we take a look at influenza-like illness, we can see here, all of Long Island, it's really a problem. And same thing with New York City. There's also a few other hot spots throughout New York State. Now let's take a look at New Jersey. New Jersey is just super concerning. Here it is for influenza-like illness. The worst is in North Jersey. But look at COVID. COVID is bad as well. You can see these really dark numbers. That's really high prevalence within a 5-minute walk of an area. And that, my friends, is relatively concerning. Let's just take a look at flu. Flu is not bad yet. Neither is RSV. A little bit more of a concern for RSV than flu. And now let's go to, where do we want to go? Let's take a look at Ohio real quickly. And we can see Ohio is not doing too bad. Some concerns around Franklin County, that would be Columbus. Then we come down to Hamilton, which would be Cincinnati area and some of their suburbs. And then Cleveland area, a little bit concerning as well. Let's check in on Florida, shall we? What's going on in Florida? And Florida should be dropping at this point. And as you can see here, overall, though, it is still moderate to high for much of the mainland of Florida, from Miami up the I-95 corridor, Orlando, cross I-4 to Tampa Bay, where it's a little bit higher. The highest in the state being in Miami. Let's check a look at influenza-like illness. You can see that's even worse at this time. Wow. Jacksonville, Orlando, Tampa, Clearwater area, Miami, Fort Lauderdale. Yes, very concerning. And let's take a look real quickly at flu. Is flu starting to show up? Remember, flu usually gets going in the south first. Not too bad, exceptions for Miami. RSV, look at this. RSV is starting to increase in that area. How about Illinois? What's going on there? Illinois, RSV is not bad. Flu is not bad. How about COVID? COVID is highest near Chicago at this time. And take a look at influenza-like illness, also highest in Chicago at this time. Now let's look at Texas real quickly. Why are we looking at Texas? Because Texas actually did update today, and we want to see what this shows for COVID. Influenza-like illness. Some of the metro cities are dealing with some issues. COVID, look at this. COVID has improved. And when we show you Texas' number for COVID, you're going to see improvements. Flu's not bad. RSV, it's there. Dallas is showing it. Houston is showing it. Let's go out to Washington State. Washington State's not doing bad for flu or RSV at this time. But when we take a look at COVID, closer to Seattle, look at this, or Spokane, Washington, yes, you are seeing some problems. Then there is influenza-like illness, but overall, not terrible. And now let's take a look at California, and then we will move on. California, influenza-like illness, highest near the Bay Area and Los Angeles, and down near San Diego. Yes, there are some concerning numbers for that. And COVID, also concerning as well. High prevalence within a 5-minute walk in many areas of California. Taking a look at New Jersey today, not good. 558 people in the hospital. In the ICU, it's now up to 70, and it does show that it was even higher yesterday. They corrected the numbers because 69 out of 70 hospitals are reporting. There were 572 yesterday, so it dropped a little bit, but again, not good. 21 people on a ventilator. Discharges, wow, 115 discharges. So we're getting into a high volume of patients in New Jersey at this time. Philadelphia, just across the river, only 713 EMS incidents. Hopefully these numbers will stay low. Taking a look at the suburbs, this is Montgomery County. Not too bad right now. There are some calls out there, but again, it's not terrible. What is terrible is this right here, Chester County, Pennsylvania. Wow. I see not 1, not 2, not 3, but 4 respiratory difficulties. I'm seeing diabetic emergency. I'm seeing heart problems galore. Yes, Chester County is busy right now. We don't like to see that. New York State, cases are slightly higher today, 2,254. And then New York State hospitalizations. This is a number I do not like to see. Hospitalizations, look at the trend. Remember they slowed down a little bit last week? Not anymore. The end of last week they started rising again. And yes, it's just basically blast off. They're really going up again. 1,594 people in the hospital. But unfortunately, the number of people in the ICU, which is at 164, is also an increase. So we are seeing New York State rise again. Let's take a look at admissions and then New York City. And we can see here when we look at admissions, it always refreshes on us. Here's the admissions. Yes, the admissions are rising as well. So while there was that brief slowdown, and the admissions show it right here, it's pretty much just resuming its trend upward today. I mean, that was a very short law. 1 week law, that's not good. And it's already rising again. Let's take a look at New York City for admissions. Same deal. Admissions are rising there as well. And here's hospitalizations. Look at this. You can see yesterday was 681, was 69 people in the ICU. Today, 704 people in the hospital, 74 people in the ICU. If I had to guess, and I'm just going to guess, it would not surprise me if this particular wave, which is setting in now, could potentially take New York City above 1,000 hospitalizations at some point in October. It's just a guess. We definitely know it's probably going to happen during the holidays if it does not happen in October. All right, drum roll, please. Time for the new update from Texas. And it's not a bad update. Texas this week reports a huge drop in hospitalizations and cases. Cases dropped by 7,400. Current week, 14,145. Previous week, 21,568. And the number of people in the hospital is down by 127 to 1,315. And the previous week was 1,442. Now to the bad news. The number of deaths, which is the last lagging indicator in a wave, is up. 54 versus 36. That's an increase by 18. So not good to see that number up. Let's take a look at some international data. Then we will take a look at some flu numbers. And internationally, we do see that Brazil did not report last week. This week they report 18,837 cases. Deaths did drop by 61%. Russia, deaths are up 71%, cases are up 25%. Then we come down here to New Zealand. Cases are down 16%, deaths are down 25%. Australia, cases down 62%, deaths down 63%. Poland, cases are up 28%, and they had 6 deaths versus 2. That makes 200% increase. Bulgaria, cases are up 67%, and deaths are also up 67%. 5 deaths versus 3. Chile, cases are up 24%, no deaths reported. Mako, cases are up 29%, no deaths reported. Then we come down here to, let's see, what do we want to take a look at next? Thailand, cases are up 10%. And Slovenia, cases are up 50% with no deaths reported. And finally, today, we will end on Panama, where cases are down 50% and deaths are down 50%, 1 versus 2 reported. Let's take a look now at some flu numbers. And we can see here, Washington, D.C. catches our eye. There are now high cases of flu going around, high flu activity in Washington, D.C. New York City is now at moderate, low in Texas, but approaching moderate levels in Wyoming, and we're also seeing some low levels now in the southeast. And taking a look at the Marinara Islands, northern Marinara Islands, we can see that flu activity is moderate. And look at Hawaii. There is also now moderate flu activity. Alrighty, folks, that does it for today's pandemic update. Hopefully I'll be back on camera again tomorrow and can get this issue rectified. Until I see you again next time, there's a couple things that you need to do. Hit like if you like this video. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this information, by all means, share this with them. We need to get this information out there that the pandemic is not over to as many people as possible, because there are so many people in denial thinking, oh no, COVID's over with. That's not an issue now. No, that's not true. COVID is still an issue, and it will be for a long time to come. I will see you all again next time. But until I see you again next time, stay safe, everyone, and have a great Wednesday evening.